Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick, chiropractor out of Commerce Township, and I'll be your host today.
And I'm your co-host, Dr. Ruven Rubenstein, chiropractor out of Troy, Michigan.
And we're here with our special guest. This is Dr. Randy Lieberman.
Thank you.
How are you?
Nice to meet you.
And Dr. Lieberman is a medical doctor who is a cardiac electrophysiologist. And a lot of people probably have no idea what an electrophysiologist is, so if you could kind of enlighten our audience about what that is.
Sure. So my field is a subspecialty of cardiology. Our training background is that we do 3 years of internal medicine residencies, then we go on to do 3 years of cardiology, and then the groups of us who want to subspecialize into the heart's rhythms, the electrical systems, we go into electrophysiology. So you can kind of think of the heart as like a car engine, where you need the fuel, which would be the plumbing system, and then the electrical system in the car to keep it beating regular.
Gotcha. So that's a lot of, so let's clear that up for our audience as well. So you did residency in first internal medicine. So that's
Right.
3 years after medical school.
Yes.
And then a lot of people know what a cardiologist is, that they're a specialist. And, that takes a lot longer to become a cardiologist than just most other subspecialties.
Right.
So then after that, you are a specialist of cardiology.
Exactly.
So everyone knows that.
Subspecialist.
So
Right.
about
A good
12 years of schooling.
Yeah, something like that.
Essentially 12.
Right.
Wow.
You look so young.
Oh, I wish.
So we're going to talk about the heart today. And I know that there's a lot of misconceptions that people have about the heart, about heart health. And so hopefully we can dispel some of those today. And I know one of the biggest ones I want to start off with is kind of the myth that cholesterol is the boogeyman. That cholesterol is the worst thing in the world, and if we don't have the right cholesterol, if we have even a little too much cholesterol, we should have none at all, we're going to die.
Okay, perfect question. The key to longevity and the key to not needing an electrophysiologist or cardiologist is focused and from the time of birth. And cholesterol is what we keep hearing about, but we all have to understand, we need cholesterol to survive. Without cholesterol, the body cannot exist. What the problem is when the cholesterol gets into the blood vessel. The blood vessels have to transport the cholesterol to all the key organs, but it cannot get beneath the walls of the blood vessel.
And can you explain to the audience the two types of cholesterol? Because most people just think cholesterol is cholesterol, but I know that there's good cholesterol and bad cholesterol. Most people, they clump those together.
Okay, perfect question. Okay, and I'm glad you brought this up. There is no such thing as good cholesterol or bad cholesterol. Cholesterol is cholesterol. Okay, now remember we said if the same cholesterol that goes to your organs to keep your organs alive or to keep your blood cells alive, that you would call that good cholesterol. Mm-hmm. But if that same good cholesterol goes inside your blood vessel, you now call that bad cholesterol, but it's the same cholesterol. Now what happens is when we eat food, okay, the food that we take in is necessary for two things. We need energy, and we usually take that in the way of what we call fats, okay? Yep. The big ones we take are triglycerides. The second thing we take in is cholesterol because we need it to survive. Now, unfortunately, those two particles don't dissolve in water. If you were to just inject the cholesterol or the fats into your bloodstream, you would clog up. So what the body does is it repackages it into a particle. Mm-hmm. And then these particles circulate in the body. And what they do is as they go along, if you're exercising, it's going to drop the triglycerides off to your muscles for energy. Now, if you're not exercising and you're taking in triglycerides, it's going to go to our bellies for fat. Mm-hmm. At the same time, as these particles are circulating around our body, and they're going to either give up the cholesterol part to the critical organs, or it's going to go inside our blood vessels. Now, the body has another particle that's circulating, and its job is to go out there and scavenge the cholesterol up and bring it back to the liver to be metabolized and used over and over again. And this is where people mistake good cholesterol.
That's what they think is good, right?
Right.
Yep.
So they're right. So we call those particles that are scavengers going around the body to take the cholesterol out of the organs or out of the blood vessels and bring it back it's called HDL.
Correct.
And then the cholesterol that you call bad cholesterol is really the particles that are transporting that are called LDL.
And let's talk about, like you said, we need cholesterol to survive, and let's explain some of the reasons and what cholesterol does. There's a lot of reasons we need cholesterol, and not only is there cholesterol that we eat, there's also cholesterol that our liver makes as well.
Yes. Okay, so the cholesterol, what it does in the body is every blood cell in the body and every cell in the body needs cholesterol in its outer lining for those membranes to be stable. All of the hormones in our body that regulate our brain functions, our temperatures, need cholesterol for that function.
So I'm glad you pointed that out. So let's talk about how chiropractic can help regulate these things. We're talking about all these different hormones are all regulated. So let's talk about what controls the hormones that get it, and it's the brain, right? Your
Right.
brain sends all these signals down your spine to your heart. So if we're talking about these things aren't functioning properly, your heart's not getting what it needs to pump, and the physiological aspects aren't working correctly.
Right. So what I like to think of is this. As we age, our body's metabolism is going to decrease by about 10% every 10 years or so. So we start to take weight on. And the reason we take the weight on is our diet. We don't change our diet. So those triglycerides are going to start to go into us and source of fat. Now the problem is we have to exercise more, okay? And if we have any of aches and pains, which you can describe better to us what the source of these aches and pains are, we don't want to exercise, okay? And this all then leads to things like sleep apnea, and it leads to less exercise, which leads to the abdominal obesity, which then sets us up as a candidate to becoming pre-diabetic or diabetic. And I mean, I see patients every day in my practice, and I say to them, all you have to do is walk 20 minutes a day. Just walk 20 minutes a day continuously. And then they begin to me with their back pain, their leg pains.
Right.
And what do? We do the wrong thing for these patients. We start rewarding what I call the criminal. So what do? We give them a pain medicine.
Absolutely, yep.
Which is absolutely the worst thing you can do, because that doesn't make them exercise.
It makes them not care about anything they're doing.
That's exactly the problem. Exactly.
Or then if they do exercise, they don't necessarily feel the pains that their body's telling them how to go around it, and they cause worse damage. They cause
And
more
then
tissue
6
damage,
months
more joint
later, a
damage.
year later, they've cycled to a worse situation.
Yeah, now
Exactly.
they exercised with these masked symptoms. They go and hurt themselves more. The next day they wake up and they can't move at all.
Yep.
Now they don't want to do anything. Now they're missing work,
Exactly.
missing family life, everything's thrown off because you said to walk 20 minutes. The problem is not the walking. The problem is what's causing those injuries in the first
So
place.
would you say that, there's a lot of ways that they can have a lot of pieces to the puzzle. Health and wellness, there's no just one perfect answer. Do this, it's perfect. They need to incorporate a lot of different things. Would you say, exercise, but diet is so important.
Yep.
Moving correctly, thinking well, moving well, everything correlates. And so there's a great place for a lot of pieces of the puzzle where a chiropractor can work with a patient to keep their spine and their nervous system functioning well. We can send them to you to monitor, make sure their heart is well and that they're dieting well. And there's a great place for a lot of different specialists or physicians to work together to accomplish the patient's goals.
Sure. I mean, I think the greatest example is if we look at our elite athletes. Okay, the elite athletes require all those components that you talk about. They need the food. They need the afterwards the massages. They need afterwards the manipulations because of the strain and stress that they put on their bodies in a game. There's a reason why when you see an elite athlete who wants a runner and he goes out to run a marathon and that day he can't complete it. Okay, it's not because he doesn't have the physical conditioning. These guys have conditioned all the time. It's because they haven't put all those components together to compete on that day. And that's just the same thing for you and I in our day-to-day of ways that we go through life. Our moods, if you wake up because you get out of bed, you have a back pain, it reflects into your work because then you go into work, you're in a bad mood. I mean, every one of these components are critical.
Absolutely. So let's go back to cholesterol a little bit too. And so we work with the spine and the nervous system. And so when we talk about the brain, cholesterol is so important with brain health. And have you seen the people that, let's say, really avoid cholesterol, when they started doing 30 years ago some diets where there was no cholesterol, low cholesterol, people developing demyelination type of diseases like more multiple sclerosis or Parkinson's disease, things like that. Have you seen things like that?
It's a fantastic question, and it's actually being studied very much. And the reason is, originally, when we looked at cholesterol, the typical cholesterol levels that you would go to your doctors and he would measure your LDL cholesterol. And originally we said, oh, let's get it down to less than 100. Now people are targeting less than 70. And now we have new drugs that are coming out that will enable us to get the LDL cholesterol down to levels of 40 and 30. And the question is, can we go too low to the point where we end up with a problem? Now, most of traditional medicine, when you look at any of our treatments, we call it a U-shaped curve. So if you think of the letter U, and to one side is good, and if you go too far past it, it's bad. And we see this with blood pressure. If we lower your blood pressure too much, you get symptomatic, you get worse outcomes. Diabetics, if we lower the sugars too low. And this has been a very big question. People have started to bring up, if we get the cholesterols too low, are we going to start to see Alzheimer's disease? Do we start to induce diabetes? So there certainly is going to be some balance where how extreme low we want to go to.
What do you think? Your expert opinion.
It was interesting. I was just at the Chicago National Lipid meetings, and this question came up. So I said to somebody, the reason we keep thinking that low cholesterol is better is that when we were cavemen, all we did is eat the diets that you're talking about. The only thing that was around was if you went out and killed an animal, and the only thing the animal could eat in those days were grass, so it was all grass-fed meat, okay? So it was all vegetarian diets, and we think that in those days, that same thing as at birth, that the LDL cholesterols were down in the 30 and 40 level. Now, on the other hand, cavemen only lived to be 40 or 50 years of age. So I think that there's going to have to depend on what your risk is to degree. If you're having progression of disease on an LDL cholesterol particle number of, say, 60 or 70, you'll want to go to 40 or 50. But I don't think the general populations want to exist at that low.
Sure, sure. And do you think that some of those dietary things have increased the amount of people with Alzheimer's, these type of things?
Alzheimer's is a complex disease, but yeah, I think that because we see an increasing percentage of it today, we have to think it's environmental and our diets and things that are leading towards it. Now, the key part also to understand is that the cholesterol can circulate in our bodies. We see people with high cholesterols all the time, and people say, well, why don't they get disease? It's also the diet that we eat. And in the diet, there's diets that increase the risk of inflammation, such as high oxidized diets or low oxidized diets. And these are some of the most important principles, because what it does is that cholesterol, even if it gets into your blood vessel, the LDL cholesterol, it has to get oxidized for the white blood cells to attack it. And if it doesn't get oxidized, the whole process doesn't get triggered.
Would you say, like, some of the indigenous people, like the Eskimos, that certain types of indigenous people ate mostly fat diets, mostly blubber, and we didn't see the levels of heart disease there that we do here because they didn't have foods with inflammation, causing inflammation, more of just
and
the
again,
fat.
the fat was a fish-based fat.
Yeah.
So just as you and I want to go out and pay money to buy the omegas, they were eating a natural omega, and the omegas are natural antioxidants. And that's why you see on all the foods when you go to buy them today, whether they tell you high antioxidants or low antioxidants.
Yep. Let's talk about, you mentioned about the cholesterol. Let's talk to our audience about, most people think that if they look healthy, they're thin, that they won't have any heart issues, they won't have any high cholesterol, and that's not always the case. You see people that are running these marathons that may have dropped dead of a heart attack, or real healthy people that have high blood pressure, look healthy, that have high blood pressure, high cholesterol. So let's let the audience know that just because you may look thin, you still have to get yourself checked out.
Exactly. What we have to understand is because we're not having chest pain does not mean we're at low risk for a heart attack. The average person who has a heart attack will have no symptoms. It's these minor lesions that are usually 30, 40% in the blood vessel that is asymptomatic, and we call them plaques, where the fat is just deposited into the vessel, that due to inflammation, that they burst and break and cause a heart attack. All the time in our body, these little plaques are remodeling. And the thing that sets us up is whether we have been having high antioxidant diets or not.
So what would you say are some of the biggest dietary things that cause inflammation and some of the biggest dietary things that can help prevent it?
Well, I think that the key part to understanding that question is, how do you protect the blood vessel you're born with? That's the first thing, because if the blood vessel is healthy, the risk for that scenario occurring becomes less. So what smoking doesn't cause heart attacks, but smoking causes damage to the blood vessel. So now the cholesterol can get inside the blood vessel easier to set up the problem. High blood pressure, hypertension. It doesn't cause a heart attack, but it causes the damage to the blood vessel. So when you look at wellness, stress. Stress is a big risk for bringing on these events. That if you take two people who eat exactly the same diet, and they were in a stressful or unstressful lifestyle, you will see that they will have much more oxidized cholesterol, much more higher risk. So the first thing is getting the basics in place. Then as you start to look at diet, it's critical that we start to eliminate these things that are in the fats that we know are bad, the trans fats, the saturated fats that we want to move away from, the animal-based fats. We have to move away from those things.
And I'm glad you mentioned that, because most people think that, I ask them, what are the first signs of a heart attack? Oh, chest pain, arm pain down my arm. No, the first sign of a heart attack is dropping dead of that heart attack. And it's too late at that point.
Yes.
So we need to get our patients and the audience aware of themselves. We need to make sure, like in chiropractic, we deal with subluxations or misalignments in your spine. You may not feel that. If their misalignments are there, putting pressure on those nerves, and those nerves are the ones leading to your heart, the signal's not getting from your brain to your heart properly, and things are going to start going wrong. So we need to make sure our audience gets in for a checkup.
And just like you said, by the time someone has chest pain, they should have been taking care of themselves years ago. We're the same way with a lot of symptoms we may see, where we say by the time someone has radiating down their arms, they should have been checked out.
Oh, exactly.
Years
I mean, I
before.
think that this is all the same scenario, and this is where people get frustrated in your field and my field, is that they want to come in by the time they're so
With a
misaligned,
symptom.
and that they think that overnight.
And they want to be cured instantly.
Right.
And they
wow,
want,
if they would have came in 15 years earlier, and whether they needed either some manipulations or whether they needed an orthotic in their shoe or something to get better alignment, the problem wouldn't have become such a catastrophe. And this is the same thing. By the time you're getting chest pain, you're asking us to undo 50 years or 60 years of health in the blood vessel. And that's also the reason why when you look at the treatments, when people say, well, why aren't the medicines curing coronary artery disease? Because we can't undo it.
There's no pill that's going to go in there, clean it out, pull everything out of there, right?
Right. It's like the difference at home. If you can put almonds on the counter for the kids to be eating almonds instead of a Snickers bar.
Yeah.
Okay, and if we can just modify our diets in these ways slowly from the beginning, then we won't be having to fight the battle at the end.
It all starts with bad habits from a childhood all the way on.
Yeah.
And most people, I mean, I've seen people, they come in and their spine looks like this, and after the adjustment, they're like, well, I still feel a little bit in my back. I go, well, 50 years it took to get there. You're expecting me to restructure it. I mean, people wear braces on their teeth for 3 to 5 years.
Exactly.
To restructure their teeth, but they want me to restructure their whole entire spine in a visit or two.
Right.
And if I don't get it, chiropractic doesn't work.
Right.
This thing doesn't work. These pills don't work. The cardiologist didn't help me. I still had these symptoms. The thing is if we just monitored people from a young age, we need to take over the way that the healthcare system works for more preventative reasons instead of sickness reasons. You don't have to have an illness to get a checkup.
Now, when should somebody come to see someone like you? What age, what type of symptom? When do you think someone should say, I'll go and see Dr. Lieberman now?
So I think there's 3 different types of patients who come to see us. The first one is if you have a family history of heart disease. Okay, so if you've had a mother, brother, sister, cousin who's either had a heart attack or a stroke, then those patients at any age need to be evaluated to make certain that they do not have a genetic risk for high cholesterol. Okay. Second, anybody as you approach adulthood, as you get into your 30s, you definitely need to be evaluated at least once to find out where your cholesterol levels are at. Fourth, as you become an adult, true adult, 40 to 50 years of age, and if you have any of the classic risk factors, diabetes, hypertension, smoking, family history, you need to then have a more advanced evaluation to make sure that you don't have subclinical
And so even if they have
coronary
no
artery disease.
symptoms, someone, they're now in their 40s, come in for a checkup.
Absolutely. And then furthermore, in the electrophysiology field, we deal with irregular heart rhythms. If you've been lightheaded or dizzy, if you've ever had a heart attack, you should see an electrophysiologist to make sure you're not at risk of life-threatening arrhythmias. If you have something that people have called atrial fibrillation, it's associated with strokes. We now can cure atrial fibrillation with ablation techniques. Many of your extra skipped beats or irregular heart rhythms, with simple catheters in and out the same day, we can ablate those and cure them. Ablation is just burning out a very small area of the tissue, about the size of a mole.
And so for everyone, let's explain that. That means when he said catheterize, that means that you don't have to cut open the
Exactly.
sternum, go through open heart like in past years
It's
ago.
just like an IV, that you start an IV in the arm. We start them in the blood vessels of the legs just because they're a little bit larger and easier to work from.
So what does sugar do? What does sugar do to blood vessels?
Oh, well, okay, so now we're getting into real biophysics here. So let's, so sugar is a quick energy source for the body, okay? It's a carbohydrate, so when we take it in, when we need it, it's very important. But what sugar does is, you have to understand, it triggers insulin, okay? And then that's going to take the sugar up into the cells. Now, in the normal individual, that's not too bad of a problem, okay? But the problem is, once you start to get abdominal fat, and there's two types of fat, and we describe people as apples or pears.
Yep.
Okay, so the apple is like where you look like you got the inner tube going around your belly, okay? And the pear shape is when the fat is lower in the buttocks region, okay? Now the fat that's in the buttocks region, usually as a stereotypical thing, was women who were pregnant. And they needed that energy source because they were supporting two lives, so they needed that constant energy there. Now the fat that gets lied down into our belly, unfortunately doesn't behave the same. So what happens is, that fat, when you go out and eat sugar, those fat cells will not take up the sugar very well. They're resistant to it. So what the body does is it has to make more insulin. Okay? And that's the downhill spiral, because one of the things that insulin does is, besides creating low sugar in the body, it also makes it so that the cholesterol cannot be made inside the liver. So it really creates a bigger problem. It also makes it where the statins no longer can work.
And what do you think about these artificial sweeteners? Are they tricking the body to still produce the insulin? Because a lot of people think that they're taking these artificial sweeteners so they can't get diabetes.
Right, so
It's
it
good for
depends.
them. They think it's
Exactly.
good. It's
I think
healthy
on
stuff.
those, it depends on where you're at in the chain. Because what happens is this: once you get the insulin resistance from here, okay, so your blood test is going to look better if you take an artificial sweetener.
Yeah.
But unfortunately, when you do take in regular sugar, by the time you get the insulin resistance where your sugar levels are too high, you've probably lost half of your pancreatic function. And then what happens is, each time you take sugar in, the body has to make more insulin because of these cells being insulin resistant. They can't take it up. And the brain's going to keep making insulin until you get that sugar level down. And unfortunately, it burns the pancreas
Can't
out.
do it, and then you're
Right, and then you get
insulin-dependent, and you get shots of
insulin-dependent
insulin
diabetes. So
because-
that's it. It's just a matter of how you want to delay
Yeah.
getting there. You're heading in the same place.
Same direction,
You got
just adding extra poisons.
That's exactly it.
I like to say sometimes that a lot of the numbers you hear, the normal for normal cholesterol, normal temperature, normal blood pressure, those in general are average normals. Not everybody is perfectly the same. It's, and a lot of times it's ranges.
Right.
Is that correct?
Correct.
So a lot of those are a symptom for the initial cause. Like you said, someone has too much inflammation, their diet is not right, they don't exercise at all, so now they may have increased cholesterol numbers. They could have liver disease and have increased cholesterol
Yes.
numbers. It's not that cholesterol causes the heart disease, it's that you have high cholesterol because you have an underlying problem, whether it's a liver disease or it's lack of diet and exercise. And so people look at those numbers like they are the cause of disease.
Right. So what happens with cholesterol is, it even gets more interesting, is that if I told you on an elevator there was 800 pounds of people on it, and I don't open the doors, you have no idea if it's 4 people who weigh 200 pounds each, or 8 people who weigh 100 pounds each. Now, this is the same thing when you go to get a traditional cholesterol test from 99% of the doctors, unless it's an advanced lipidologist, which I practice lipidology also. And what happens is that in advanced lipid testing, we not only measure the weight of your LDL cholesterol that you're calling bad, but we actually look at how many particles there are. So we open the elevator door. So you may have an LDL of 100, and you may have an LDL atom of 100, but you may have 100 particles, and he has 200 particles. Now think of a wall, and you want to push the wall down. And you can go out there and recruit 100 people or 200 people. Well, you want 200. You don't care how small or big you are. You want more weight pushing that wall down, okay? And that's the same thing. So it's the particle numbers that translate to the disease. And that's why you're absolutely right, that knowing the level of the cholesterol doesn't help. You have to know your particle numbers.
And that matters when it comes to prescribing the drug also. Most people think, okay, I've taken this drug and now my levels are leveling out.
Right.
That may not be good for them.
Exactly. It happens to be that the statin drugs do not work on these very small LDL particles. And remember I told you that if you have 100 particles and he has 800 but it weighs the same, his are very, very small. Okay, and so those very, very small ones are very statin resistant as a way of thinking of it. And that's why you hear of people being on these drugs and still getting disease. It's also why you may have heard, like my grandfather, he used to have chicken fat on the table. It was called schmaltz in the old days.
Yeah.
And they used to dip it in there and they would eat fat directly. And I'm sure his cholesterol was very high, but genetically he was lucky. He had big particles.
Oh yeah, you take the shot of vodka and a little bit of herring and
That was
you're
it.
good to go.
That was it.
Schmaltz.
Yeah.
So would you say something, you know, if someone, let's say, does have high cholesterol and they did start statins, ideally they would then make dietary and exercise changes to be able to eventually get off that.
Right,
Where
so
feel
what
like a
I
lot
do-
of people rely on, now I have my medication, I'm cured, I just take this and I'm good.
Right. So what I do with patients are 2 things. I have one who comes in who is fairly healthy, undergoes advanced lipid testing, and we identify risk. Okay? So that patient, we give them 2 choices. One choice is I can put you on a drug, make your numbers look better, okay? And then in 9 months, if you do diet and exercise, in 9 months, we will stop your drugs and see if you've been able to maintain a lifestyle. Everybody does great for 4 weeks on diets, okay? When we all got married, we all miraculously lost weight or something like that, but you know, a year later it was back. Now, so that's one option for how I do it with people. I also am willing to do it if it's a motivated patient who says, you know what, I don't want any drugs. I'm more than willing to look in 9 months and see have they been able to achieve the same way, one or the other way. Now, for people who have manifest disease, okay, and that group of patients, I always start them on treatment and then 9 months later, tell them, let's see if you've diet and exercise, if you can
Makes
come
sense.
off it.
Right,
Well, that's all the time we have for today, and thank you so much for joining us.
This has been
Again,
exciting.
Dr. Randy
Thank you very
Lieberman.
much. I enjoyed it.
And that's all the time we have. You've been watching Ask the Chiropractor, and we will see you next time. I'm Dr. Adam Rodnick out of Commerce Township, Michigan.
And I'm Dr. Ruven Rubenstein out of Troy, Michigan.
Stay healthy.